morning and thanks for joining us. I'm Michael Cook, Chief of the Public Information Office. I'm here with David Waddington, our Chief in the Chief of Social Economic and Housing Statistics Division. Today, we are releasing the latest income, poverty, and health insurance findings for the nation. This includes some state-level statistics and the Supplemental Poverty Measure. Immediately after the presentations, we'll open the phone lines to answer questions from the media. So please, call in now if you are a member of the media who would like to participate. Dial 888-942-8169 and enter passcode 711-7029 when prompted. You'll be placed on hold until the question and answer session begins. Resources for today's news conference are available on census.gov. Click on the slider at the top of the homepage or go to the newsroom to find the electronic press kit. And be sure to visit America Counts, Stories Behind the Numbers. After today's news conference, we will release new stories on the latest income, poverty, and health insurance findings. Without further delay, here's David Waddington.
Thank you, Michael. Good morning, and thank you for joining us. Today, we are releasing 3 reports. Income and Poverty in the United States, 2018, Health Insurance Coverage in the United States, 2018, and the Supplemental Poverty Measure, 2018. The Income and Poverty Report and the SPM Report are based on data from the Current Population Survey's annual Social and Economic Supplement. The Current Population Survey is the longest-running survey conducted by the Census Bureau and is the official source of the national poverty estimates. The estimates of official poverty are calculated in accordance with the Office of Management and Budget Statistical Policy Directive 14. The Health Insurance Report includes data from both the Current Population Survey and the American Community Survey. The American Community Survey is an ongoing survey that has much larger sample size than the Current Population Survey, making it the recommended source of health insurance statistics for smaller populations and levels of geography. This year marks the culmination of a multi-year effort to improve how we collect and measure income, poverty, and health insurance in the Current Population Survey. These improvements have been implemented in a 2-step process, beginning first with questionnaire design changes incorporated over 2014 to 2016. This was followed by more recent changes to the data processing system. While improvements made to data collections have been reflected in the estimates for years 2013 to 2017, this is the first year estimates will reflect the updated processing system. The new data processing system improves how the Census Bureau edits and imputes income data and assigns family relationships. It also provides details on health insurance coverage and the type of coverage over the year. Estimates presented today for 2017 and 2018 reflect this updated processing system. The 2017 estimates may be different from those published last year, which were produced using a legacy processing system. In 2019, the Census Bureau examined the impacts of these processing changes on income, poverty, and health insurance estimates for 2016 and 2017 in working papers, presentations, and other materials. Please visit the CPS ASEC redesign website for more information. Additionally, you can get more information by watching a webinar that was recorded last week that provides details about the changes to the survey and the processing system. Last week's webinar can be found on the second link on the screen. So to repeat, all findings and comparisons we are presenting today were produced using our updated processing system. So now let's take a look at the main findings. Median household income was $63,200 in 2018. Not statistically different from the 2017 median, following 3 consecutive years of annual increases. The official poverty rate in 2018 was 11.8%, down 0.5 percentage points from 2017. In 2018, there was 38.1 million people in poverty, a decrease of 1.4 million people from 2017. The Supplemental Poverty Rate or Supplemental Poverty Measure, or SPM rate in 2018 was 13.1%, not statistically different from the 2017 SPM rate of 13.0%. The percentage of people without health insurance coverage for the entire calendar year was 8.5%, a 0.5 percentage point increase from 2017. In 2018, 27.5 million people did not have health insurance coverage, an increase of 1.9 million people. Now, let's turn to our subject matter experts for a closer look at the findings, starting with income and poverty. And as a reminder, immediately following these presentations, we'll take your questions.
Income and poverty statistics gauge the health of the U.S. economy. We're able to see national trends and compare the economic well-being of different groups, such as women versus men, children versus people aged 65 and older, and urban versus rural residents. Income is a measure of all cash or money resources coming into a household. It includes wages and earnings from work, as well as Social Security benefits, retirement income, interest, dividends, and public assistance. It does not account for taxes paid, tax credits, or non-cash assistance such as SNAP benefits, Medicaid, and Medicare. We often talk about changes and trends in median household income. The median is the value that divides the income distribution in half. So half of all households have income above the median, half below. Poverty is a measure of how many individuals live in families with incomes below the poverty threshold, meaning they don't have adequate resources to meet their basic needs. Thresholds vary by the size of the family and the ages of the family members. In 2018, a family with 2 adults and 2 children was considered in poverty if their income was below $25,465. Poverty rates help government officials and social services providers develop policies and target benefits.
The Income and Poverty Report is based on data from the Current Population Survey's Annual Social and Economic Supplement, CPS ASEC. Let me begin by summarizing the main findings regarding income, earnings, and work experience. Median household income was $63,200 in 2018, not statistically different from the 2017 median. The 2018 real median earnings of men and women who worked full-time year-round increased by 3.4% and 3.3%, respectively. The number of full-time year-round workers increased by 2.3 million between 2017 and 2018. The number of men and women full-time year-round workers increased by about 700,000 and 1.6 million, respectively. Let me start by giving more details about the changes we observed in household median income. This chart shows median household income from 1967 to 2018 in real inflation-adjusted dollars. Recessions, as defined by the National Bureau of Economic Research, are depicted in this and all time series charts in light shading. Median household income was $63,200 in 2018, not statistically different from the 2017 median, following 3 consecutive years of annual increases. At first glance, it would appear that median income was higher than every year prior to 2017, surpassing the median income for 2007 and 1999. However, making comparisons over time requires caution, since these estimates reflect changes implemented to the survey, including the redesign of the income questionnaire for data year 2013 and an update to our processing system this year. As a result, some of the apparent differences over time could be due to these recent improvements to the data. To understand the impact of these changes, we have released income estimates for 2013 and 2017 with and without the improvements. Our analysis of the redesigned income questions found that they increased estimates of median household income for 2013 by about 3.2%. The updated processing system did not have a statistically significant effect on median household income in 2017. The estimates from 2017 and 2018 presented today reflect both improvements to the data. One method for adjusting pre-2017 estimates to make them comparable to the ones shown today is to adjust them to reflect the differences we see in the 2013 and 2017 estimates. With this adjustment, as shown by the purple dashed line on this slide, and after adjusting for inflation, the 2018 median household income is not statistically different from the pre-recession estimate for 2007, or the year with the highest estimated median household income, 1999. These adjustments are not made in our official publications, table packages, or the rest of this presentation because they would require the assumption that the impact of the data improvements would have been identical in all years. Now looking at income by race and Hispanic origin. The 2018 real median income of Asian households increased 4.6% from 2017 to $87,200, while the median incomes of non-Hispanic white, Black, and Hispanic households were not statistically different from their 2017 medians. Among the race groups, Asian households had the highest median income in 2018. A quintile divides all households into 5 equal groups ranked by income from lowest to highest, so that 20% of all households are in each group. This is shown by the bar on the left of this slide. The bar on the right shows the share of aggregate income received by each quintile. The lowest quintile received 3.1% of total household aggregate income, while the highest quintile received 52%. In fact, the highest quintile received more income than the other 4 quintiles combined. Looking closer at the highest quintile, we can see that the top 5% of all households received 23.1% of total aggregate household income. Using the information about the distribution of household income, we can produce a Gini index, a widely used measure of inequality. The Gini index is a statistical measure of income inequality ranging from 0 to 1, indicating higher inequality as the index approaches 1. The money income Gini index was 0.486 in 2018, not statistically different from 2017. These next slides switch to earnings and work experience data for people aged 15 and older. Here we see historical data on the real median earnings of all workers and full-time year-round workers from 1960 to 2018. Earnings are the sum of wages, salary, and self-employment income. In 2018, 79% of aggregate income came from earnings. The 2018 real median earnings of all workers increased 3.4% from 2017, although changes in median earnings of male and female workers were not statistically different from the 2017 estimates. In 2018, the real median earnings of men and women who worked full-time year-round each increased by 3.4% and 3.3%, respectively. Here we see the female-to-male earnings ratio historically. The female-to-male earnings ratio compares the median earnings of women working full-time year-round to the median earnings of men working full-time year-round. The 2018 female-to-male earnings ratio was 81.6%, not statistically different from the 2017 ratio. Year-to-year changes in this ratio are not common. However, the female-to-male earnings ratio has increased 4.8% from 77.8% in 2007. This slide shows the number of workers historically by work experience and sex. Between 2017 and 2018, the total number of people with earnings, regardless of work experience, increased by 1.2 million. The number of women with earnings increased by approximately 1.1 million, while the change for men was not statistically significant. The number of men and women full-time year-round workers increased by about 700,000 and 1.6 million respectively between 2017 and 2018. This continues a shift from part-time, part-year work status to full-time, year-round work status. Now we'll take a look at poverty. This slide shows the official poverty rate and the number of people in poverty. The official poverty rate in 2018 was 11.8%, down from 12.3% in 2017. In 2018, there were 38.1 million people in poverty, a decrease of 1.4 million people from 2017. In 2018, a family with 2 adults and 2 children was categorized as in poverty if their income was less than $25,465. This is the 4th consecutive annual decline in poverty. Since 2014, the poverty rate has fallen 3 percentage points, from 14.8% to 11.8%. For the first time in 11 years, the poverty rate in 2018 is lower than the poverty rate in 2007, the year before the most recent recession. Estimates of official poverty rates are calculated in accordance with the Office of Management and Budget's Statistical Policy Directive 14. Here we demonstrate differences in poverty trends for people across race and Hispanic origin groups. In 2018, the only group to see a decline in poverty rates was non-Hispanic whites, declining from 8.5% in 2017 to 8.1% in 2018. The poverty rate in 2018 was 20.8% for Blacks, 17.6% for Hispanics, and 10.1% for Asians. This slide looks at poverty rates by age. For individuals under age 18, 16.2% were in poverty in 2018, down from 17.4% in 2017. Poverty also decreased for people aged 18 to 64, from 11.1% in 2017 to 10.7% in 2018. People aged 65 and older had a poverty rate of 9.7% in 2018, not statistically different from 2017. In this slide, we compare poverty rates for families from 1959 to 2018. The Census Bureau has three different primary family classifications: married coupled families, male householder no spouse present families, and female householder no spouse present families. In 2018, poverty rates declined for families overall and for female householder families specifically. The poverty rate for married coupled families was 4.7%, while for male householder families, the poverty rate was 12.7%. Year-to-year changes were not statistically different from the prior year for these groups. The family poverty rate decreased 0.3 percentage points to 9%, while female householder family poverty rates declined 1.3 percentage points to 24.9%. The poverty rate for female householder families in 2018 is among the lowest rates on record for this group. Poverty rates for these families have declined in 3 of the last 4 years, a total decline of 5.8 percentage points since 2014, and the largest decline over this period among family types shown. The gap in poverty rates between married coupled families and female householder families has decreased from 26.9 percentage points to 20.1 percentage points during this time period. With this in mind, we turn our focus to female householder families to identify where these changes are happening. The only statistically significant changes in 2018 are for families with Black and Hispanic female householders. In 2018, the poverty rate for Black female householder families declined by 2.5 percentage points to 29.4%. For Hispanics, poverty declined 2.6 percentage points to 30.8%. The 2018 poverty rate of 19.7% for families with a single non-Hispanic white female householder was not statistically different from the prior year. Next, we examine year-to-year changes in poverty for people by region. In 2018, poverty rates for 3 of the 4 regions in the U.S. declined from 2017. The region that did not experience a decline in poverty was the South, where the poverty rate was 13.6% in 2018. In 2018, the poverty rate for the Northeast was 10.3%. For the Midwest, the poverty rate was 10.4%. For the West, the poverty rate was 11.2%. More information on income and poverty is available in the report and online.
Governmental programs are designed to provide a safety net for some of the nation's most vulnerable families and individuals. The Supplemental Poverty Measure, or SPM, helps us to estimate how well these programs are working to pull people out of poverty. The SPM extends the official poverty measure. It starts with cash income, then adds non-cash benefits such as food and nutritional assistance programs, energy assistance, and housing subsidies, while subtracting out necessary expenses like taxes, healthcare, commuting, and childcare costs. The SPM uses poverty thresholds produced by the Bureau of Labor Statistics based on spending on food, clothing, shelter, and utilities. These thresholds are adjusted for family size and composition, as well as for geographic differences in the cost of housing.
The SPM report is based on data from the Current Population Survey's Annual Social and Economic Supplement, or CPS ASEC. The SPM does not replace the official poverty measure and is not used to determine eligibility for government programs. Let me begin by summarizing the main findings from this report. The SPM rate in 2018 was 13.1%. This is not statistically different from the 2017 SPM rate of 13.0%. The SPM rate for 2018 was 1.3 percentage points higher than the official poverty rate of 11.8%. There were 16 states plus the District of Columbia for which SPM rates were higher than official poverty rates, 22 states with lower rates, and 12 states for which the differences were not statistically significant. The SPM uses thresholds produced by the Bureau of Labor Statistics from Consumer Expenditure Survey data. Separate thresholds are created for renters, homeowners with a mortgage, and those who own their homes free and clear. While the official poverty threshold is constant throughout the United States, the SPM adjusts for geographic differences in housing costs. This map shows those differences, with yellow areas having lower thresholds for renters than the official poverty threshold, and blue and green areas having higher thresholds. This slide compares the SPM estimates for 2018 with the SPM estimates for 2017 for all people and by age group. The 2018 SPM rate for the entire population was 13.1%. This is not statistically different from the 2017 rate of 13.0%. SPM rates were not statistically different for any of the major age categories in 2018 compared with 2017. SPM rates for children under age 18 were 14.5%, adults aged 18 to 64 had a rate of 12.5%, and adults aged 65 and older had a rate of 13.6% in 2018. This slide compares the SPM estimates for 2018 with the official poverty estimates for all people and by age group. The 2018 SPM rate for the entire population was 1.3 percentage points higher than the 2018 official poverty rate. Looking at specific age categories, the SPM rate was lower than the official poverty rate for children, but higher than the official poverty rate for people aged 18 to 64 and people aged 65 and older. Census Bureau estimates for the SPM are available back to 2009. Since the SPM's initial production, the SPM rate has been higher than the official poverty rate, ranging from 0.6 to 1.6 percentage points higher than the official poverty measure over this period. While the SPM national poverty rate was higher than the official, that difference varies by geographic area. This figure shows the United States divided into 3 categories by state. There were 16 states plus the District of Columbia where the SPM rates were higher than official. These are shaded orange. There were 22 states where the SPM was lower than official. These are shaded blue. And finally, there were 12 states where the differences in rates were not statistically significant. These are gray. One important contribution that the SPM provides is allowing us to gauge the effectiveness of tax credits and transfers in alleviating poverty. We can also examine the effects of non-discretionary expenses, such as work and medical expenses. This graph shows the impact on the 2018 SPM rate of the addition or subtraction of a single resource element. Some of these elements, such as Social Security and unemployment insurance, are included in the official estimates. Other elements, such as the Supplemental Nutrition Assistance Program benefits and refundable tax credits, are included only in the SPM resource measure. Using this chart, we can see that 27.3 million people were taken out of poverty by Social Security benefits. This figure also shows the breakdown by age, with the majority of individuals taken out of poverty by Social Security aged 65 and older. 7.9 million people were taken out of poverty by refundable tax credits. 3.1 million people were taken out of poverty by SNAP benefits. However, subtracting medical expenses from income increased the number of people in poverty by 8 million using the SPM. More information on the Supplemental Poverty Measure is available in the report and online.
Health insurance coverage is an important measure of our nation's overall well-being. Whether it's illness, injury, or preventative needs, health insurance provides greater access to medical care, protection from high unexpected costs, and more economic stability. Each year, the Census Bureau provides data on health insurance coverage. We look at who is and isn't covered, where they live, and what type of insurance they have. Policymakers use this information to make data-driven decisions.
This is Larissa Makita, Health and Disability Statistics Branch Chief, and I'm here to present today's findings. The health insurance estimates released today come from 2 surveys. The Current Population Survey Annual Social and Economic Supplement, or CPS ASEC, asks people about their health insurance coverage at any time in the previous calendar year. The national level results presented today come from this survey. Today's CPS ASEC health insurance estimates are based on the updated processing system. These health insurance estimates should only be compared directly to estimates based on this updated processing system. State-level estimates released today come from the American Community Survey, which asks people about their coverage at the time of the interview. Due to its larger sample size, the American Community Survey is the recommended source of health insurance statistics for smaller populations and levels of geography. Let me begin by summarizing the main findings this year. An estimated 8.5% of the population, or about 27.5 million people, did not have health insurance coverage at any point in 2018. Between 2017 and 2018, the uninsured rate increased 0.5 percentage points, and the number of uninsured people increased by 1.9 million. This represents the first year-to-year increase in the uninsured rate in the CPS ASEC since 2008 to 2009. The percentage of people uninsured at the time of their interview decreased in 3 states and increased in 8 states between 2017 and 2018. In 2018, most people, 91.5%, had health insurance coverage at some point during the calendar year, with more people having private health insurance, 67.3%, than public coverage, 34.4%. Looking at private coverage more closely, employer-based insurance was the most common subtype of coverage overall, covering 55.1% of the population. 10.8% of people purchased their coverage directly. The updated processing system allows us, for the first time, to distinguish whether this coverage was through a state or federal health insurance marketplace, such as healthcare.gov. In 2018, 3.3% of people, or 30.8% of people with direct purchase insurance, obtained their coverage through the marketplace. In 2018, 34.4% of people had public coverage, which includes Medicare, Medicaid, and VA and CHAMP VA coverage. Over time, changes in the rate of health insurance coverage and the distribution of coverage types may reflect economic trends, shifts in the demographic composition of the population, and policy changes that affect access to care. The percentage of people covered by any type of health insurance decreased 0.5 percentage point between 2017 and 2018. This decrease was primarily driven by a change in public coverage. Between 2017 and 2018, the percentage of people with private coverage did not statistically change, and the percentage of people with public coverage decreased 0.4 percentage points. Among public coverage, Medicaid coverage decreased 0.7 percentage points, while Medicare coverage moved in the opposite direction, increasing by 0.4 percentage points. This increase was partly due to growth in the number of people aged 65 and over, and not a change in Medicare coverage for adults in this age range. Age is strongly associated with the likelihood that a person has health insurance. In 2018, adults aged 65 and over had the lowest uninsured rate, 0.9%, followed by children under the age of 19, 5.5%, and adults aged 19 to 64, 11.7%. Between 2017 and 2018, the uninsured rate increased for adults aged 35 to 44 and 45 to 64, as well as for children aged 0 to 18. Indeed, in 2018, 5.5% of children under the age of 19 did not have health insurance coverage, a 0.6 percentage point increase from 2017. For many selected characteristics, the percentage of children without health insurance coverage was significantly higher in 2018 than in 2017. However, the change was not uniform across groups. For example, the uninsured rate did not change for children and families with income of less than 400% of poverty. However, it increased 0.7 percentage points for children living in families at or above 400% of poverty. In both years, the rate of uninsured declined as the income-to-poverty ratio increased. The updated processing system allows us to report more detailed information than previously available, including subannual or within-year health insurance coverage. Among the 296.2 million people covered at any point during 2018, most, 96.4%, had health insurance coverage for all 12 months, while 3.6% had coverage for 1 to 11 months. That is, most people with coverage during 2018 had coverage throughout the entire calendar year. Most people with private coverage and with public coverage also had their coverage for all of 2018. The larger sample size of the American Community Survey allows us to observe the uninsured rate, as well as changes in the uninsured rate at the state level. This map shows the uninsured rate by state in 2018. Lighter colors represent lower uninsured rates, and darker colors represent higher uninsured rates. 6 states and the District of Columbia are in the lightest shade of blue, with less than 5% of people uninsured at the time of interview. 6 states in the darkest shade have an uninsured rate of 12% or higher. This map presents the change in uninsured rates. Between 2017 and 2018, The percentage of people without health insurance coverage decreased in 3 states and increased in 8 states. Statistically significant decreases ranged from 0.3 to 1.8 percentage points, and all increases were 1 percentage point or less. More information is available in our reports and online. We have a number of tables and figures on our website, in addition to an America Counts story that looks at changes in coverage for children, and a Research Matters blog that highlights a new measure of health insurance coverage at the time of interview, that we include in our report for the first time this year. Additional data products based on the American Community Survey will be available on September 26th.
That concludes our presentations. To recap the highlights, the median household income was $63,200, not statistically different from the 2017 median. The official poverty rate is down 0.5 percentage points to 11.8%. The Supplemental Poverty Measure rate was 13.1%, not statistically different from 2017. And the percentage of people without health insurance coverage was 8.5%, a 0.5 percentage point increase from 2017. I will now turn it back over to Michael.
Thank you, David. Let's get ready to open up the phone lines to questions. Joining us now, in addition to David Waddington, are his counterparts from the Social, Economic, and Housing Statistics Division. Larissa Makita, Branch Chief of Health and Disability Statistics, as well as Trudy Renwick, Assistant Division Chief of our Economic Characteristics. Please state your name and your media affiliation when you ask a question. We want to give everyone an opportunity, so we're allowing just one question and one follow-up. Operator, do we have our first caller?
Again, just press *1 to ask a question. Our first question comes from Janet Adamy with Wall Street Journal. Your line is open.
Hi, Janet.
Hi, thanks for taking my call and for doing this. Just to clarify on the income growth, can you, Trudy, explain in any more detail what contributed to the results we had, whether it was changes in hours worked or changes in wages? And then also, just to be clear, you mentioned how this compared to previous peaks in '99 and '07. Can you also describe that in a little bit more detail?
Thank you for that line of questioning, Janet, on income and comparing peaks and valleys and changes, and particularly the first part of your question, I believe you're asking about impacts and things that might have affected those. I'm going to turn that over to Trudy.
Okay, thank you, Michael. Well, the first question, you can see from the data that we've released today that we've had increases in employment, both all workers, but particularly a large increase in full-time, full-year workers. And so we can see that that's a shift from part-time, part-year work to full-year, full-time work. On the median income historical series, as we explained in the slides, when we do the corrections to take account for the improvements we've made in both the questionnaire and the processing system, the median household income in 2018 was not statistically different from either 2007, the year before the most recent recession, or 1999, which is the peak income year in our historical time series.
Thanks for that. Operator, do we have a next caller?
Yes, our next question comes from Howard Snyder with Reuters. Your line is open. You may ask your question.
Hi, Howard.
Yeah, I think that doesn't really address what the question was, and let me rephrase it. Can you decompose for us why growth in median household income stalled between 2017 and 2018? There is a 3.4% increase in earnings. Why did the median stall over the last year? And secondly, could you decompose for us a little bit where the drop in health insurance, what's driving the drop in health insurance?
I'm going to go first back to Trudy on the income before then going to Makita on the health insurance question. Thanks for that.
Okay. Well, you can see that median household income growth slowed. It was 0.9%, but that was not statistically significant relative to 2017. So it was up, but the increase was not statistically significant.
As for the differences between changes in earnings and changes between income, it's a fairly complicated question. Household income includes the money from everybody in the household, earnings and non-earnings, while earnings are a personal measure of just what one individual is bringing in. And so we've had many years where we will have earnings up and income flat, or income up and earnings flat. So it's not unusual for those numbers to be inconsistent. We have, I don't want to exaggerate, hundreds of tables on our website that you can look at and maybe help you do this decomposition a bit more.
And then to Makita for the question on health insurance.
Okay, thank you. So yeah, we did see an increase in the uninsured rate of 0.5 percentage points. And while we don't look at sort of causal impacts, we also saw at the same time an increase in a decline in public coverage between 2017 and 2018. Medicaid declined, but Medicare coverage increased over that period. Private coverage did not statistically change.
Thanks, and I hope those answers your questions. Operator, do we have our next caller?
Thank you. Our next question comes from Ricardo Alonso Salvador with Associated Press. You may ask your question.
Hi, Ricardo.
Thanks for taking my question, and it has to do with health insurance again. And so this is the first increase in the uninsured rate since what year? My follow-up question is just to verify that the largest drop in coverage was Medicaid, because you said public coverage and then an increase in Medicare, but a drop in Medicaid.
Okay.
Larissa?
Okay. All right. So the first question had to do with, was this the largest increase in the uninsured rate, or since when has it been?
The first increase in how long? It's the first increase in how long?
Okay, so it's the first year-to-year increase since 2008, 2009. But we had updated the processing system, so we can't say whether it's a larger increase or a smaller increase. We can't talk about the magnitude of the increase, but we can say that it's the first one since 2008, 2009. And as to your second question, Medicaid coverage decreased by 0.7 percentage points between 2017 and 2018. And Medicare coverage increased 0.4 percentage points.
And when you say 2008 to 2009, what you really mean it's the first increase since 2009, right? It's a little bit confusing the way that's presented. There was an increase in 2009 from 2008, and then 2018 is the first time it's gone up again.
That's correct. That's correct.
Yeah. Thank you.
All right, thanks for that question, and thank you, Larissa, not Makita. I'll get this straight. Operator, do we have our next caller?
Our next question comes from Gina Silek with New York Times. You may ask your question.
Good morning.
Good morning. Thank you for taking our questions. I was hoping to just chat about the equivalence adjusted income shares in Figure 3 on page 7. I'm just wondering if you could give us a little bit of color on what's driving the improvement sort of in the lowest 3 quintiles and the declines in the top 2 quintiles.
Thanks for that question on income. Over to Trudy as we're pulling up those slides now. Trudy?
Hi. Well, we don't really, we've given you a lot of numbers, and we have a lot of tables online. We can't really explain why one quintile goes up or why another one goes down. These are pre-tax cash income, and we have found quite a big increase in full-time year-round work, and that would tend to bring up incomes of working people who we could find in those bottom quintiles of the income distribution. But I can't really give you a precise, this is why this happened, or this is why one went up or one did not. Sorry.
Thank you for that question. Operator, do we have our next caller?
Thank you. This question comes from Tammy Luby with CNN. You may ask your question.
Hello, Tammy.
Hi, thank you. Hello, thank you very much for holding this call. Just two questions. One, to clarify, Trudy, what you just said, a big increase in year-round full-time work. I just want to make sure that was year over year, so that's the 27 to 2018. And then also on health insurance, if the, I'm trying to understand, and I know you probably don't work this through like this, but if the economy is doing better and there's a greater increase in full-time year-round work, one would think that the private coverage would have gone up. But you're saying that Medicaid declined, so there were fewer people on Medicaid, but there was no change in employer-based coverage?
Are we tracking that?
Or no statistically significant change? I'm wondering if some of those Medicaid people, if any of them, went to private coverage, or they just dropped off and, I guess, they became uninsured, which is why that rate went up.
Thanks for that, Luby. I'll have Trudy clarify that year-over-year income question, and then Larissa will take on health insurance.
Okay, I'll take the easy one first. Yes, that was a year-to-year increase of 2.3 million more full-time year-round workers, 2018 versus 2017.
Okay. Yes, private coverage did not show a statistical change between 2017 and 2018, and neither did employment-based coverage. In terms of, did some of the folks that saw a decline in Medicaid or came off of Medicaid, did they get picked up by employment-based coverage? Researchers can, and the public can take a look at our data products, analyze the microdata to answer those specific research questions.
Thanks for that.
I'll just add one more piece of that. With the current population survey, we were actually sampling these people. It's not a longitudinal survey, so we don't actually know which people are coming on and off from year to year. We do have other surveys that are more longitudinal where we can follow those things, such as our survey of income and program participation, which actually follows people over a 4-year period. And with that, you can see how people change coverage and move in and out of poverty and change types of coverage.
Did you have a follow-up, Tammy?
No, that was good. Thank you.
Thanks for that. Operator, do we have our next caller?
Our next question comes from Margot Sanger-Katz with New York Times. Your line is open. You may ask your question.
Hi, thanks for doing this, guys. I have another question about the uninsured numbers. I'm looking at Figure 5, and I know you guys highlighted this change in the uninsured rate among children. I just want to make sure I understood the income composition of this change. It seems like you guys were seeing the largest increase in the uninsured rate among children of higher incomes. I just want to make sure, first of all, that I am interpreting that correctly, and also, again, if you have any explanation for why that might be happening, if you can, see how it's changing in private or public coverage for that group or something else.
Thanks
Okay.
for that.
Oh.
Go ahead.
Oh, sorry.
Totally.
Okay, yes, so in Figure 5, we do show that the only income to poverty group that experienced a significant increase in the uninsured rate among children were those with incomes at or above 400% of poverty. Uninsurance rates are still highest for those in lower income to poverty categories. States have varying income threshold cutoffs for Medicaid and CHIP coverage, so some of that could be from kids in slightly higher income to poverty categories losing eligibility. But we haven't sort of sorted out why.
Thanks for that. Operator, next question.
Thank you. Our next question comes from Selena Simmons-Duffin with NPR. Your line is open. You may ask your question.
Hi, I'm just wondering if you have any other thoughts on the change in children's health insurance rates. In addition to the poverty, it looks like you broke it out by race, and that Hispanic children have lost a significant amount of coverage, and whether you have any thoughts on what could be going on there.
I'll kick that back to you, Larissa.
All right, thank you, Michael. So health insurance coverage is affected by a variety of different factors, including changing economic conditions, shifts in the demographic composition of the population, as well as policy changes at the state and federal level. At the Census Bureau, we provide estimates, quality estimates of health insurance coverage and changes in coverage from year to year. But we don't look necessarily to tease out causal impacts. We have an America Counts story. For more information on children's health care coverage, we do have an America Counts story that's released today.
Thanks for that question. Operator, do we have our next caller?
Thank you. And this question comes from Chris Rugabar with Associated Press. You may ask your question.
Hi, Chris.
Hi, thank you. Hey, just can you give us any additional color, any additional detail on racial breakdown? I'm sure some of that was gone over in the call I may have missed, but particularly, say, income gaps between white and black households, white, Hispanic. It appears to have increased, but I may be looking at that wrong.
Thanks for that question on income and income gaps directly related to racial compositions and breakouts. I'll turn that over to Trudy Renwick, who will address your question on
Sure.
income.
So we have a slide in our presentation. Let me find which slide it is. On page 14, that looks at real median household income by race and Hispanic origin. And for between 2018 and 2017, the only group to see an increase in their median household income were households with an Asian householder. The changes for the other race and ethnic groups were not statistically significant. In our report, you can find the ratio of median household income by race to non-Hispanic white households who serve as our comparison group. And you can find the specifics on that in the text of our report.
Thanks for that. Operator, do we have our next caller?
Our next question comes from Jamie Frazier with State House Media. Your line is open. You may ask your question.
Hi, Jamie.
Hello. Could you talk a little bit about the states that saw decreases in insurance coverage and whether there were any particular types of coverage shifts there in the types of policies they have, or whether that was driven by demographic or policy changes?
Okay, states decreasing health insurance. I'll turn that over to Larissa.
I'll start that. Yeah, so on September 26th, when the rest of the ACS, or when a good portion of the ACS data is released, we're also releasing a health insurance brief on type of coverage, health insurance by type of coverage and by state, where you'll get a much more detailed look in what happened in health insurance coverage across the states.
Thank you. Operator, next caller.
Thank you. Our next question comes from Phil Gallowitz with KHN. You may ask your question. Your line is open.
Hi, thanks for taking my call. Another uninsured question. Any thoughts about why the Medicaid rate dropped? What might have caused that? Is that just the economy, or is that something else?
Thanks for that.
Well, as I mentioned before, there are lots of different factors that affect health insurance coverage, including changes in economic conditions, shifts in the demographic composition of the population, and policy changes at the state and federal level.
Thanks for that response, Larissa. Operator, do we have our next caller?
And again, just press *1 if you'd like to ask a question. Our next question comes from Deanne Shang. Your line is open. You may ask your question.
Hi, thank you. I have a question for the median income. So you mentioned earlier the median household income was not statistically different. Could you tell more about why it is not statistically different?
Thank you for that median income question. And whether it's statistically different or I'll turn that over to Trudy.
So I'm not quite sure I understand your question, but we calculate for every estimate that we have in our report, we calculate a margin of error. And if the difference is not greater than that margin of error, then we say that it's not a statistically significant change. Since the increase was 0.9% in median household income and our margin of error was 1% for changes in median household income, we classify it as not statistically significant.
Is that what you were after, caller? Does that address your question?
Could I just correct that? If it's okay to say the real median income remains statistically unchanged from last year, if that's correct?
Yes, that's correct.
Great, thank you.
You're very welcome. Operator, do we have another caller?
Thank you. Our next question comes from Andrew Keshner with Market Watch. Your line is open. You may ask your question.
Hi, Andrew.
Hi there. Do any of the figures talk about or show any sort of results of the tax cuts now that they went into effect in 2018?
Could you be more specific?
Well, I guess specifically, how about in the the quintiles on income? Is there any sort of rates of change or any sort of rates that it might be attributed to the effects of the of the tax cuts?
I'll let Dave take that one.
So you're right. There were obviously several policy changes that have taken effect that took effect in 2018. But the income measures that we have and those things that are in those quintiles are actually all pre-tax. Those are the earnings that people earn, and it's all pre-tax income. So that wouldn't reflect the potential tax rates that people had on there.
How about then in supplemental poverty measure, if that takes into account like tax credits?
Yeah, so the supplemental poverty measure does actually have in the one table there, you can see the impact, and we do account for the programs that actually help the low-income families as well as necessary expenses such as the EITC, the taxes, and there's a couple of different types of taxes that are accounted for in there. So those in the one table, you can actually see the impact of the taxes, and if you'd like, you could actually look at the data for this year's 2018 SPM and compare the impact of those to the 2017 SPM and see if say those tax rates had a different level of impact on the SPM.
Okay, thank you.
And thank you for that question. Operator, do we have our next caller?
Our next question comes from Mary Ellen McIntyre with CQ Roll Call. Your line is open. You may ask your question.
Hi, thanks for doing this. You guys have answered most of my questions on the health insurance rate, but I did just want to ask a quick technical question on the changes in methodology to the CPS. And have you guys updated your last year's data in how we're comparing that to this year, or is that not significant because of the changes in methodology?
I'm going to turn that one over to Dave.
Yeah, thanks for that question. It's a very good question. So I'll encourage you to go back and look at the webinar that we recorded last week that actually details extensive changes on what we did that Trudy recorded last week, and that actually goes through all the changes that we did. But to directly answer the specific question, we did actually reprocess the data for 2017, and we also have a research file for reference year 2016 that shows the data processed in the new processing system. So you can go back and look at those data. And again, all the comparisons that we made today for 2017 are in our bridge file that we wrote, that we created for that specific purpose to make the estimates comparable.
I think Trudy has a little bit more to add to that.
For income and poverty, we have released a full set of detailed tables that have the 2017 estimates done with the new processing system so that you can see all of our detailed tables online, processed both ways, with the legacy system and with the updated system. And those have been online for about a month now.
Okay, thank you.
Very welcome.
So I'll just point out that we also have an entire website or entire page on our website attributed to this where we have all the papers where we conducted our analysis and we show those findings. And you've got the several data sets that are up there for 2016 and 2017 for income and poverty as well as for health insurance.
Very well. We got you covered. Operator, do we have our next call?
Yes, our next question comes from Tammy Luby with CNN. You may ask your question.
Hello again.
Hi, so 3 questions, hopefully relatively quick. One is, I just wanted to confirm, you're saying it's the first year-over-year, the health insurance increase is the first year-over-year increase since 2009. So during the Great Recession, the uninsured rate did not go up?
Thank you for that line of questioning.
And that was one, and I have 2 more.
Let's answer or deal with this one first, and then we'll come back to you for your follow-up, okay? So your first line of question was, is this the first year-over-year increase since 2009?
So it's the first year-to-year increase in the uninsured rate since 2008 to 2009. That's correct. So comparing 2017 to 2018, we saw an increase. Comparing 2008 to 2009, we saw an increase. The other year-to-year comparisons in between, increases were not statistically significant.
Okay, so there was so in 10 to 11, 9 to 10, all of those when the Great Recession was really terrible and everybody was losing, their jobs. There were no statistically significant. There were no increases in the uninsured rate during that time.
Well, actually, the trough of the Great Recession was in June of 2009. So the economy started to grow again after June of 2009.
And can I add?
Yes.
So there's public coverage and private coverage, and sometimes during a recession, more people are able to access public
That's
coverage.
True. Okay. Very nitpicky point. You were saying that the uninsured rate went up 0.5 percentage point, but the numbers are 7.9 to 8.5. So I assume, is that rounding?
That's rounding, yes.
Okay, I'm going to have to tell my editor that. But anyway, and then just finally, what would you say was driving the increase in the uninsured rate? Was it the decline in Medicaid? Was it the increase in children's coverage, or the increase in children's uninsured rates? What would you say are the one or two main drivers of the increase?
Again, we don't seek to identify causal impacts. What we do is provide health insurance as a measure of well-being and changes in coverage over time.
No, I understand that, but numerically, what was driving it?
So the decline in public coverage certainly contributed to the overall increase in the uninsured rate, especially because private coverage did not statistically change. So it wasn't offset by a change in private coverage. So the decline in public coverage.
And what about the children? The role of the decline in children's coverage?
For the children, we saw a similar pattern where there was a decline in public coverage and no statistical change in private coverage. Yes.
Okay. All right. Thank you very much.
Thank you for your follow-up questions. Operator, do we have our next caller?
Yes, our next question comes from Reese Jones with USA Today. You may ask your question.
Hi, thanks for the call. My question is, the median income stayed statistically the same, though earnings went up. Is that because other income sources like Social Security income, et cetera, went down?
Trudy?
Not necessarily. As I explained before, median income is made up of these other sources, and it's also combining all of the income for everybody in the household, while earnings is a personal measure. So somebody at the who is in a household that is making the median household income doesn't necessarily at the median for earnings. And so since those are two different groups of the population, they can move in different ways.
Okay. All right. Thank you.
Thank you for that question. Operator, our next caller.
Our next question comes from Ellen Wolfhorst with Thomson Reuters Foundation. You may ask your question.
Hi, Ellen.
Hi, thank you. I have a question about the wage gap between men and women. So it's statistically unchanged. I just wonder if anybody has any thoughts about why it hasn't changed, perhaps given so much attention paid to the issue, and if it's been leveling off since that increase of 4.8% since 2007.
Thank you for that question on the wage gap. I know that we'll be able to get into the actual numbers and those changes, but the drivers behind it, sometimes we can't necessarily go into detail, but Trudy she'll address as much as we can.
Sure. Well, it's unusual for us to see a year-to-year change in that female to male
earnings ratio, partially because they're both medians and they have rather substantial margins of error. But we do see that since the year before the recession, 2007, that has gone up by 4.4%. And since 2012, it's gone up by 6.7%. So we have seen improvements over the past decade for sure.
Thanks for that. Does that address your question?
Yeah, it does. Thank you very much.
Let me add that we have an America Counts story that will go live at the end of this press conference that's going to talk about the relative gains of men versus women. We found this to be a fairly good year for women. We see their numbers going up both in total workers, full-time year-round workers, and their earnings up and their poverty rates down.
Thank you.
You're welcome. Very well. Operator, I believe we have our last call.
Our last call then comes from Kim Chrisberg with the Nation's Health. You may ask your question.
Hi, thanks for taking my question. Can you just repeat or clarify, there was a statistic you mentioned about, it was something like the top 5% of households there was about 23% of income. Can you verify or correct what I heard? And can you give a little bit of historical context? Has that changed a lot from prior years? And I also wanted to verify, I believe what you said was that there was no statistical difference that you found in income inequality between 2017 and 2018. I just wanted to verify that as well.
That's a three-fer. Okay, thank you. We'll send that down to Trudy to address your questions on income.
Okay, well, thank you. Thank you for the question. You're correct that the highest quintile of the income distribution received 52% of aggregate income in 2018, and the highest top 5% of the income distribution received 23.1% of aggregate income. We did not see changes in this between 2017 and 2018. In fact, the only quintile that saw growth in its share of aggregate income was the second quintile, the second to the lowest quintile. In our report, we have a table that will show you these shares by quintile going back through, I think, back to 1967, so that you could look at how it's changed over time. As to the third part of your question regarding the Gini index, like the female to male earnings ratio, it's not a number that often has a year-to-year statistical change, but it has been trending up.
And thank you for...
Can you quickly say whether that, in terms of, like you said, the highest quintile receiving 52% of aggregate income, can you just quickly say if that's stayed about stable in the past few years? Are they getting more? Is that quintile getting more than they typically have? Can you just quickly say how that's changed?
So that has not changed since last year, if that's what you're asking me. If you can look in our historical tables and you can see how it's changed over time. I don't have that in my head, I'm sorry.
Okay, thank you.
Very well. Thank you for joining us for today's news conference. Before we wrap up, I'd like to direct your attention to several key products scheduled for release. Results from the 2018 American Community Survey are available under embargo for public release on Thursday, September 26th. The data set provides single-year estimates for geographic areas with populations of 65,000 or more. 5-year American Community Survey data will be released later this year. The embargo begins December 17th for public release, December 19th. These estimates will be available for all areas regardless of population size, down to the block group level. If you have additional questions about today's news conference or wish to arrange interviews, please call the Public Information Office at 301-763-3030. The general public may call our Customer Service Center at 1-800-923-8282 for assistance. And just a reminder to visit America Counts, Stories Behind the Numbers, on census.gov for new stories on the latest income and poverty health insurance findings that we've discussed today. You can also connect with us at U.S. Census Bureau. Finally, I'd like to thank our survey respondents. The Census Bureau conducts more than 130 surveys each year, including the American Community Survey and the Current Population Survey. Information from this and other surveys generates data that helps determine how billions of federal, state dollars are distributed each year. Respondents make that possible. For David Waddington, Larissa Makita, and Trudy Winwick, I'm Michael Cook. Thanks for joining us.